and right to go. There are currently 16 active cases of coronavirus in Victoria. There have been 2 new locally acquired cases notified to the department in the last 24 hours, and we'll go into the detail of those soon. There were 22,849 test results received today. That brings to over 4.6 million the number of tests that have been conducted, the test results that have been received throughout the pandemic. Before I get to the detail of those cases, which are the cases that the Minister spoke to yesterday, and the very strong public health response that we have put in place since, I first want to make some comments about these variations or variants of concern, these mutant strains. These are, as we know, highly infectious, hyper-infectious really, and it is a very significant cause for concern, not just for us, but I think for every government and public health officials right across the country. This is a wicked enemy made more challenging by the fact that it is changing. It's a moving target, and that really does cause significant concern for all of us. You've heard me speak many times about the fact that our reset hotel quarantine is the most risk averse. It is the most labour intensive. Elements of it are in fact now the national standard. But even then, with all of those steps, and can I say a willingness to do more where we need to, these hyper-infectious strains are proving very difficult to contain. And that's a real challenge, not just for today, but indeed for the weeks and months ahead as we move towards vaccinating the elderly, the frail, those who would be most susceptible to this virus. There's no reflection on any system. It's simply the fact, and we need to acknowledge it, that it's not a static enemy. It's wicked and it is changing, and that means that we have to redouble our efforts to do more and to respond to that unique challenge, a challenge that is very different than what it was a month ago, let alone what it was 3 or 6 months ago. So in terms of just an update on the matters that the Minister spoke to yesterday, so firstly, the second case in a hotel quarantine worker at the Holiday Inn, that person tested positive and is a food and beverage attendant at the Holiday Inn. She last worked on the 4th of February and tested negative at the end of her shift. She developed symptoms on the 6th of February. On the 8th of February, she was advised that she was a primary close contact related to the previous identified exposure at the Holiday Inn and was, as such, required to isolate and get a test. She got tested on the morning of the 9th and returned a positive result. During the time she was infectious, she visited a number of sites in the Sunbury area, and those are those Tier 1 exposure sites that we have listed on the website, and we would commend all Victorians, particularly those in and around that community, to be well acquainted with those sites. And if you were there during those times at those locations, then you're required to isolate and to get tested. The exposure sites will be added to or refined as information comes forward, and it really is critically important that people, if you've been at those sites during those times, you've got to isolate and you've got to get tested, and if you need any support or assistance, then obviously through the website we're more than happy to provide that. I have no further exposure sites to add to that list. If and when we do, then of course we will. We've so far identified 13 social and household primary close contacts linked to this case. Each of them have been contacted. They're isolating at home. There are several high-risk individuals within that cohort. Last night, as part of our rapid public health response, we arranged for them to be tested after hours, a special run if you like. 5 have so far come back negative, and the balance of those results should be available to us today. And as soon as we're in a position to update you, then we will. And I want to thank those laboratories and all the other people involved in that extra effort, if you like, to keep us all safe. Now, onto the case of a hotel quarantine resident at the Holiday Inn, the other case that was announced yesterday by the Minister. As was advised, this individual exited quarantine on the 7th of February and got tested out of an abundance of caution on the 8th. Returning a positive result a day later. Interviews with that person have been conducted, and their close contacts and others have all been contacted. I should say there are no exposure sites. That person basically stayed at home so it'll only be family members and others. So that's quite contained, and we're very pleased to be able to report that. In terms of the very first case at the Holiday Inn, that is the authorised officer that we spoke to you a couple of days ago about. That person tested positive on the 7th of February. Current exposure sites are again published online. Anyone who's visited those, just as the Sunbury example, you need to isolate, you need to get tested. That's how we keep you safe, your family, and every single family. We identified 8 household and social primary close contacts of that authorised officer, the very first Holiday Inn case. 6 of them have so far tested negative, and once we get the balance of those tests, again, we will update you. Finally, just in terms of cases, the family of 3, who are 3 of the 6 cases linked to the outbreak at the Holiday Inn. This family was residing in hotel quarantine as hotel quarantine guests, not staff, but as hotel quarantine guests. We believe that the transmission of the UK strain occurred prior to them entering Victoria. 2 members of this family remain in hotel quarantine with our support, and 1 member of that family has been moved to hospital. That person is dealing with some very significant health challenges, and we wish them well, and we again take this opportunity to thank staff for the outstanding care that they provide. The Chief Health Officer will speak to our working theory and evolving theory in relation to contributing factors to transmission in just a moment. But before I do that, I want to make a couple of important announcements. As a result of this outbreak, the Holiday Inn at the Melbourne Airport will be closed for a terminal clean. So that's that very deep clean to the highest of standards, and it's simply not possible if there are guests at that hotel. I wouldn't read any more into that beyond the need to do that clean, and you simply can't do it if there are people there. So that'll be done as quickly as possible. Those guests have and are being moved to alternative hotels. That'll be done safely, but that what's called a terminal clean, the clean that would normally happen after guests had left, that's being done across the entire hotel, and that's again through an abundance of caution. Also, anyone who has spent time in the facility, any more than 15 minutes in that facility, between the 27th of January and the 9th of February, worker or resident or visitor, for whatever reason, is now considered a primary close contact of this outbreak and will be required to isolate for 14 days and to get tested. That again is an abundance of caution and the right thing to do, and that's based on the very best of public health advice. If they are currently in hotel quarantine, their 14-day period of quarantine will have to start again. I apologise, that will be very challenging for those people, but we simply cannot run the risk of this variant, this hyper-infectious strain of COVID-19 getting out into the community, and some of the inconsistencies that we've seen in the way the virus presents, back to that point I made about being a moving target, a changing enemy. The fact that people can test negative multiple times and then present with symptoms and a positive result many days later, that's why we have added that 14 days on. That 14-day period we believe is still the useful benchmark, but an abundance of caution is required in this case, as it's required across the board. I can also make it very clear, and the Prime Minister's office has been informed of this, as a result of this outbreak and the fact that we really need to get to the bottom of what's going on here, have a better understanding of the risks posed by these variants, these mutant strains. We will not be increasing to 1,310 arrivals per week as was planned from Monday. That has been paused, and we will have further announcements to make about when and if we can make that jump. But that will not be occurring on Monday. The Prime Minister, through his office, has been informed of that. We believe that it is appropriate to have a very low tolerance, or perhaps no tolerance, for risk, particularly risks that you don't quite understand, and that's the nature of some of these events and the need to further work on this evolving theory, run these things to ground. We're not taking any risks that would see us have to get to a situation where we ask Victorians to deal with other restrictions. You know, Victorians have given a lot, and I just won't run the risk until we know and understand exactly the nature of the challenge that this changing virus presents to us. As I said many times to you, we have no second jobs. Everybody works exclusively for us. There are no private contractors. We're ripping up carpet, for heaven's sake, and replacing it with vinyl in a whole range of common areas. We test everybody every day. We test them on their days off. The list goes on, and still, this wicked and changing enemy can be a step ahead of you. That's the challenge we face, and we all have to acknowledge that quarantine and the public health response today must be by necessity different than it was a month ago or 6 months ago, because the enemy we're confronting is different than it was a month ago or 6 months ago. In terms of further announcements, I might now, not so much announcements I should say, I might just finish where I always make the comment, because it's more important perhaps than ever. If you have any symptoms, however mild, please come forward and get tested, and please do it today. Nothing is more important in terms of protecting every single Victorian, seeing our recovery continue, seeing our low or no coronavirus status safeguarded, protected. We've all given so much, and we all have to be vigilant, playing our part, following the rules. But the most important rule, if you've got any symptoms whatsoever, please come forward and get tested today. We had a big test number yesterday. We want to keep that going, and we'll get your results back to you within 24 hours. And if you are positive, then we can help you not to spread this. We can support you not to be giving this to family and friends, strangers, that then in turn spread this virus across the Victorian community. I now might ask Martin to speak to a number of different matters, including testing. Then Brett can take us through this evolving theory, which is, again, not necessarily proven yet. We still have to work through, and as you know, these cases all become like links in a chain, and if you get negative results in certain places, you can rule out some of those chains of transmission. If you get positives, on the other hand, then you're able to then put forward a more complete picture. I know it's frustrating not necessarily being able to answer all of those questions and have that completely clear picture, but that's the nature of this virus. It always has been. It's now made even more challenging by the fact that it's changing, and so too our response must change to it. There's no question here about standards. Everyone's doing as much as they can and more than many parts of the world. The question then becomes, though, is that enough? And that's why we've always said we'd never rule out making further changes. We'd never rule out going further. All of that's based on public health advice, as it should be. I'll now ask the Minister to add to my comments.
Thank you, Premier. So I want to also thank those nearly 24,000 Victorians who came forward to get tested yesterday. It was an outstanding effort, and that's the most important thing that we can all do. So in response to what we expect to be, particularly in the northern and western suburbs, increased demand today, we are expanding our testing efforts, particularly in and around the Sunbury and Hume areas. Text messages have been sent to over 34,000 residents in Sunbury, alerting them that exposure sites in their area have been identified, and those are the sites that you should all be familiar with by now. In terms of our rapid response testing team, we've added substantial capacity to both existing sites, and as of 9 o'clock, our rapid response testing team have set up at the Clark Oval on Riddle Street, Sunbury, and at the Goonawarra Recreation Reserve in Lancefield Road in Sunbury. That rapid response team are also investigating a couple of other sites as to further drive-in locations which we will be establishing in the very near future, in addition to the existing 7 testing sites in the Hume and surrounding areas. And for the sake of completeness, those are the existing test sites at Western Health Sunbury Respiratory Clinic in Timmins Street, the site at Tullamarine for the same organisation at 157 Mickleham Road, and the Hume City Council offices in Broadmeadows, as well as the Roxburgh Park Youth and Recreation Centre on Lakeside Drive in Roxburgh Park, the Djerrawarra Health Service in Melton West, and the DPV Health Community Health Centre on Schrotters Road in Mernda, and together with the Banyule Community Health Centre in Civic Drive in Greensborough, these existing sites will all be expanding their capacity and hours of operations. The best way to look at those sites as to when they're open and availability of support is to hop online. There will be active diversions in place, as we've managed over recent times, to make sure that the wait times are minimised. It's going to be a warm day, so please bring some water, look after yourself while you're waiting. And if you are able to drive, there's a few close by in addition to that. Those being the Mickleham Road Tullamarine site, Victoria University, McKechnie Street in St Albans, and as I've said, the Hume Council in nearby Broadmeadows. For more information, please visit the coronavirus.vic.gov.au site, and here you will see the live up-to-date figures on wait times and the suggested ways in which you can minimise your waiting whilst you get that very important test. In regards to wastewater, as we've reported, we've upped to the daily arrangements wastewater testing in and around Melbourne, and we've uncovered a number of unexpected detections, something to which we now know we need to be alert to, and those have particularly been in the catchments in Coburg and Reservoir. We're working through the primary close contacts and others from the expected lists of contacts to the known Holiday Inn and other cases to match those, but we would alert that persons residing in or visiting these areas in the 72-hour period through to the morning of the 6th of February should, if they have any signs of illness, any signs of symptoms, to get tested, and just to be alert for possible symptoms, particularly if you are in those Coburg and Reservoir areas. There are no known cases residing in those particular catchments, but there are a number of close contacts, as I've indicated. There's also been an unexpected detection in a catchment in the Glenroy, Broadmeadows, West Meadows and up to Roxburgh Park area. Of course, that does link in with some of the areas linked to persons that we know about. But again, anyone residing or visiting in these areas in the 48 hours through to the morning of the 8th of February, again, monitor your symptoms. Please come forward to get tested with even the slightest of conditions, and keep an eye out for your well-being. And of course, as I indicated, one of the cases that we know about that we've reported does live in that particular catchment. Again, we just need to make sure we ask the people of Hume, Moreland and Darebin to stay extra alert, check for exposure sites, and if you have symptoms, please get tested. It's the most important thing you can do. I'd ask maybe the Chief Health Officer to say a few words.
Thanks, Minister. Certainly the working hypothesis at the Holiday Inn at the moment is that our 3 cases are related to an exposure event that involved a medical device. So that medical device is called a nebulizer. It really vaporises medication or liquid into a very fine mist. And if that's breathed in, especially when it's used as medication and someone is infectious or later tests positive, then that picks up the virus, and that mist can then be suspended in the air with very, very fine aerosolised particles. And so we think that the exposures are all to that event, the use of a nebulizer, which then meant that the virus was carried out into the corridor and exposed the authorised officer, the food and beverage service worker, and also the other resident. That makes sense in terms of the geography, and it makes sense in terms of the exposure time. So that's a risk, and in a sense we need to be acutely aware of the possibility of everyone who was on that floor in particular being exposed to that. They are all, of course, notified, they're quarantining, they'll be tested, but we have included the entire workforce of the Holiday Inn, all residents and visitors on that basis, because the risk with an aerosolised virus is very substantial. And so I think we should expect more cases, but obviously we've wrapped the public health around those individuals, and we're going very broadly with the quarantine requirements. So we're intending to get ahead of this. We will get ahead of it, but it does make sense in terms of the use of that particular medical device that's aerosolised the virus.
How far away? Oh, sorry, can we go to questions?
Just one clarification first, just for the benefit of those watching who may be caught up in this. Just let me clarify, all of those who spent 15 minutes or more at this facility between the 27th of January and the 9th of February, worker or resident, must isolate for 14 days, must get tested. If you are in hotel quarantine and you are currently being moved to a new hotel because we're doing the terminal clean at the Holiday Inn, you will have to continue your quarantine for at least 3 days. It may be the full 14, but at this stage it will be at least 3 days, and then subject to testing and the evolution of this theory, we'll keep people informed. So I think I may have indicated they were in for another 14. That may not be the case. We'll just have to be evidence-based in that, just for the reassurance of anyone in that category who might be watching thinking they're facing another 14. It's 3, it could be 14, but let's take this one step at a time. And now we're happy to take any questions you have.
Can I ask that hotel quarantine worker has worked there last shift on the 4th, they've then felt symptoms on the 6th, but hasn't been tested until the 8th. Why is that?
Oh, I'm not sure. We have to work that through. Obviously, sorry.
Will that worker go back to hotel quarantine given they've been out and about experiencing symptoms and haven't?
Yeah, we'll need to follow that through. They may have good reason for that. Obviously, it's always best to have any symptomatic Victorian that time to test that we talk about, those exposure days. The best thing is, as I've said literally thousands of times, and millions of Victorians have done this, if you've got symptoms, getting tested is very important, but getting tested quickly is even more important. We'll follow that through. The issue here, of course, is that moving to testing not just daily but on days off is a very important response to this as well, given that and I doubt that very many others have seen this phenomenon, that you're testing every day, you're getting multiple negatives, and then only a short time thereafter, despite that nasal swab, so the test that's at the highest grade, the most accurate, you're then getting a positive case a day, 2-3 days later. So that's why the day off testing, I think, is very important.
This worker developed symptoms on the 6th. We weren't on the 7th, that another worker at the Holiday Inn was tested positive, and as you've said, he or she didn't get tested until the 9th. Are you disappointed, given that person knew that someone at their workplace had tested positive, knew they developed symptoms, that they waited 3 days to get tested?
Oh, look, I'd encourage all Victorians with any symptoms, or if notified that you, because of your movements and the people that you've come in contact with and the places you've been, if you're urged to get tested, please don't delay. That's the most important thing, to get tested when you've got even the most minor symptoms, or if you're advised that you may have been at an exposure site or in the company of someone who has tested positive. Getting tested, very good. Getting tested quickly is absolutely essential. We can't change that, but that's been my position and been my advice to Victorians for a long time now. I don't. The family was in the room with the family of 3, and I think that there's a person there, and we'll be very careful in terms of privacy. There's a person there that's got underlying conditions, and again, we don't want to be being too specific, but that person, as I think the Chief Health Officer indicated yesterday, is currently very, very unwell and is currently receiving intensive care.
Given that you said it's not the system's problem, that it's actually the person used the nebulizer, and then was it the authorised officer first developed symptoms? What's the timeline of, I guess,
I might let the Chief Health Officer take you through the timeline.
So we think the nebulizer was in use on the 3rd and 4th of February, so really the exposures happened on one or more of those days for our positive cases. But potentially we're going back to the 27th of January on the basis that there were positive cases in the hotel at that time, or potentially infectious cases in the hotel at that time, right up until yesterday.
So Brett, a nebulizer is also something that can be known as a spacer, is that?
No, a spacer is the football-shaped attachment to the the little puffer that's used for Ventolin or other asthma medications. A nebulizer is literally something that forces air through to create a very fine mist for the purpose of inhaling medication. It's also used, air purifying can also aerosolise, so that's the risk.
So it's actually putting vapour up into the room.
So for the purpose of breathing in, it's nebulising the medication.
And at that point, it's so that cloud, for want of a better word, has made it outside the room, or are you worried about the ventilation?
No, so aerosolised particles can, because they're so tiny, can remain suspended in the air for several minutes, and therefore if the door of the room is opened, again for getting a meal, that aerosolised virus is sitting in the air and can move out into the corridor.
So the assumption is, or you know from the video, the authorised officer was at the door?
So what we know is that the authorised officer, the food and beverage worker have been on the floor for a period of time on those relevant days. We don't have the exact correlation with the door being open, but as I say, with aerosolised particles, they can remain suspended in air for several minutes, and so it doesn't have to happen at the same time.
So can we assume therefore that the other guest had a room pretty close to that?
Well, even aerosolised particles can travel for metres, so it is an issue, aerosolising virus with any procedure, with any medical device, and so it doesn't have to be immediately adjacent.
How far away is the other guest room? Across the way?
Emma might need to speak to the setup.
So the other guest that tested positive was in a room. The Holiday Inn is like a triangle shape. The family of three were here. They were directly opposite.
Oh, so they were opposite.
Correct.
Were the two workers wearing N95 masks?
The two workers that attended the floor would have been in surgical masks and goggles at the time.
Does it prove that they might need N95 masks?
So what we've done since is on Friday we held an emergency steering committee with our panel of experts and we asked that question of them, and I think that we talked about that on Monday. What we're doing, and the advice was not to move to N95s. We are now reconvening that panel again today with a paper that suggests that we do move to N95s with a process of fit checking and fit testing.
Is it worried that all three cases...
Sorry?
Why the reluctance to have N95s?
This is based on the expert advice. Yeah.
What was the advice?
The expert advice is essentially that if you're using N95s and you don't go through the rigour, just as hospital settings and aged care do with fit testing and fit checking, you can actually put people more at risk. We know working in N95s is particularly challenging in terms of, they are uncomfortable to wear and they're hard for staff to wear, but we don't want to increase the risk by having staff who are poorly trained wearing N95s and increase the risk of contamination.
But now you are going to get them all with N95?
We are taking that to our expert panel today.
So just to be clear, we've essentially asked, well, CQV is essentially asking those same experts, in light of what's occurred and what we know, and this evolving theory, to re-examine the advice that they've given us. And I think that they will most likely endorse a paper that's going to them today that will see us do N95s, but also fit training and fit testing.
Do you think hotel quarantine is still viable?
Well, I think that hotel quarantine is a very big challenge with these new mutant strains. I don't think there's any way to get around that. This is not the virus.
Not continue?
Well, I'm not making any announcements to that end. What I am saying though is that we were set to take about 200 more people per week from Monday, and we are not doing that. We are pausing until we have, double, triple checked to make sure that there's not anything else we can do. We're already making changes each day, each week, based on what's happening in other states, what's happening in other parts of the world, what's happening here. That culture of always looking to do more, I think, is very important. In fact, it's never been more important, given that it's not a static enemy. This thing is different today and could be different again next week or the week after. There's some stuff in the UK overnight about whether there might be different strains of the UK strain. The South African experience in recent days, I would draw your attention to some comments in relation to the vaccine that the head of the South African Health Department made overnight. This is presenting lots of challenges in many different places.
Can I just ask the same question again in a different context? The
Sure.
Park the family from Nigeria who transmitted to the woman from Malaysia,
Yes.
I've been told cases of the virus were found with 3 or 4 doors down the corridor, so it's clearly travelled the virus a long way down the corridor. Is the quarantine program still viable in those buildings?
Well, I think that hotel quarantine, if we are in fact dealing with a hyper-infectious aerosolised virus, an airborne transmission challenge, is very, very difficult. Very difficult. I wouldn't be doing my job if I didn't say that. It is very challenging, and despite all the measures we've put in place, despite many experts indicating that they are good measures, strong, robust, the most resource intensive, the lowest risk tolerance, all of that, we may need to do more. And therefore everybody will probably have to do more. We've not had a South African case here yet. We want to do everything we can to keep that out, and we want to do everything we can to limit the spread of the UK strain any further than it's already spread, and that's why getting tested quickly, and if you've been asked to isolate at home, you can't cut corners with that. You've got to stay at home, you've got to be genuinely away from other people, and if you need support and assistance with that, then we're ready and willing to offer that to you.
We have said that there is no fault with the system. If the nebuliser theory works out to be correct, does that mean that we will see the same amount of transmission as, for example, Queensland and Sydney have seen within the hotel, which is much smaller? They've had cases, but obviously not
Yeah.
many. Is that likely to be where we're at if the nebuliser is the correct theory?
Yeah, it's probably a little bit, it's a good question, Alex, but it's a little bit difficult for us to predict. What I would say though is the best indication about the seriousness of these cases is the fact that a good portion of those closest contacts have been tested and returned negatives. That's not to say that some of them won't test positive, because we haven't got all the tests back. And the other challenge that we're facing, further to Raf's point, I think, is that we're seeing people who test negative and then subsequently test positive. That's not new, but the whole kind of time frame from start to positive test and all the negatives in between seems to be getting longer. So that's another challenge that not just us, but Paul Kelly yesterday talked about a piece of work to, not state specific, but a national review, if you like, of the suitability of all the arrangements we have in place, we being First Ministers across the whole country, in the context of a changing virus.
But obviously New South Wales and Queensland and everyone else is dealing with the same infectivity with they've both had UK strains.
Yes.
So I guess we're trying to get to the point of, if it isn't the nebuliser, then does that say that we actually do have a problem with our...
No, I wouldn't say that at all. I wouldn't say that at all. And I'm not entirely sure, I need to come back to you on exactly how much UK strain has got out of New South Wales hotel quarantine. I'm not entirely sure that that's accurate, but I would need to check. Queensland, every state's different in terms of the virus they have to deal with. Cohorts are different as well, where people are coming from, all those sorts of issues. But look, I just think the most important thing is for me to be clear with Victorians that we know and understand this is a different challenge than it was a month ago, and we have to respond to that. And the good news is that we are doing that. What's more, other states and territories are doing the same thing, and there's a good, strong national cabinet process to do that. That is, of course, in addition to the announcements that the Prime Minister made on Friday, where Phil Gaetjens, the head of PM&C, together with all of his state and territory colleagues, are sitting down. They've already had meetings to try and figure out what's the next phase of this virus look like. It's not just strains, not just mutant strains, but also once we get more and more people with the jab, do our parameters change? Does our framework, if you like, the rules of engagement, for want of a better term, does that need to change?
Yeah, as you know, thousands of Australians are stranded overseas. How is it that you won't be increasing your caps here in Victoria, leaving other states to do the heavy lifting, when you were happy to take in 1,200 tennis players and staff, when you were very much aware that the UK virus was existing and a possible risk?
Well, again, I think there's a number of assertions and assumptions in your question. I'm not doing things that aren't safe. That's the answer to your question. And it would not be safe. It would not be safe to go to 200 more on Monday. And therefore, we will not be going 200 more on Monday. And people are free to form their own views on that. The return of Australians is the responsibility of the Commonwealth Government. so too is quarantine. We have assumed that responsibility, and that means we get to control the system and make these sorts of decisions. And that's the basis on which we're running hotel quarantine, and I act on advice. And I've informed the Prime Minister through his office that that will not be occurring on Monday. Hopefully it can occur at some later point, and again we're due to have further increases in a staged way, but Monday is not the time to be increasing the workload and therefore the risk while we're still running these issues to ground, and we're still dealing with, as I've said to you many times today and many times in recent days, this is not static, it's changing, and we have to change along with it, otherwise it will get ahead of us.
Do you stand by your comments though that Victoria has higher standards than other states in the rest of the country when it comes to hotel quarantine?
I've been very clear about the facts of these matters. I don't think that other states would be copying a model that was anything. Well, the only reason staff are getting tested every day is because.
Sorry, Premier, what other states are copying Victoria's model?
Well, with the greatest of respect, if you ask the questions and then I'll answer them, and if I can complete a sentence, then we'll be able to get to the next one. So, what was your question again? What other states? All other states. It was a national cabinet decision. So I think that probably answers it. I'm here to talk about what we're doing here in our state. People can draw conclusions, people can run commentary. I'm not interested in what's going on in other states, other than that it may well affect us. That's the only field of reference here. We have a robust system, and given the nature of this changing challenge, we need to do even more. That tells you something. That tells you something about the nature of this virus and the fact that the challenge is very different today than it's ever been.
While we're on the point of
Sure.
higher standards, Gladys has obviously come out and had a bit of a whack at you, saying that you're very good at spin in relation to this issue. And
I'm not interested in having an argument with Gladys, and I'll somehow find a way to recover from that barb. You know, I'm focused on keeping Victorians safe, as I'm sure she's focused on keeping the people of New South Wales safe.
She also said the measure of the success of a hotel quarantine system is being able to bring back a large number of overseas returned travellers, and and then having the smallest number of community transmissions as a result of that. Given that we are going, as of Monday, we'll be quarantining about a third the number of New South Wales, and we've had 5 transmissions in the last week.
Hang on. Transmissions inside hotel quarantine and transmissions outside hotel quarantine. Let's be clear about these issues.
3 of them are workers who've been out.
Yeah, indeed. Again, I would say that the only thing I am concerned about is keeping Victoria safe and keeping Victoria open. That's what I'm focused on.
Premier, can I just clarify, the person from the family of 3 who's been taken to hospital,
Yes.
is that the same as the person you mentioned yesterday in ICU, and do you have an age or an age range?
No, I don't, but I can just simply say to you that person is very unwell and is receiving intensive care, and if there's any further updates we can provide to you without... It's not so much a matter of detail, but it's about, there's a line when you provide so much detail that you're essentially identifying the person. If I can get you an age range, I will.
Is there a reason that person was in the Holiday Inn and not in a complex care hotel, given that they evidently had underlying health issues?
Yeah, I don't think the underlying health issues would be at a level that would, anyone who's got an asthmatic in their household probably knows what a nebulizer is, or anyone who's had a baby, a very small baby who's had some of those respiratory issues that babies get from time to time. One of those units that, like a steam, you can have medication in it as well. These are quite common devices, and they don't necessarily speak to very serious illness, but they can be associated with a chronic or complex condition that could be quite low grade. So I think there's also, we have not seen this yet, but logic tells you that there's a reason why these machines shouldn't be used, and that'll present a challenge for us to try and cohort people. The same could be said, I think, for sleep apnea machines as well. This is the nature of running hotel quarantine. Everybody's unique, everybody's different, and we have to try and bring a risk rating and an appropriate response to each and every person. Yeah, that no one's using those machines. They're not. Again, let's not be critical of someone who is in intensive care, and I'm sure didn't believe they were doing the wrong thing, but we're taking extra steps to make sure that those machines are not in the hotel, therefore they cannot be used. This was a personal machine. It travels with the person. It'll be, I think, linked to this underlying condition, whether it's asthma or something like that. Let's not be critical of someone who is very unwell and in intensive care, but those machines will not be permitted, and we will take extra steps to guarantee that they cannot be in the hotel, which will deliver that outcome.
So were machines like that forbidden already?
Yeah, they were. But again, it's not about blame, and to be really frank, I don't think it is in any way appropriate for us to be running a negative commentary on someone who is essentially fighting for their life. So let's look to what we can change, and that's the future, and that's exactly what we've done.
Hey, maybe questions about the holiday fit for purpose in the first place, saying largely on the government through these increasing ventilation audit.
Sean, happy to look at that. We've had ventilation audits, engineering reports, we've done all manner of things. With the greatest of respect to the AMA, I'm not sure what they base those concerns on, but we're happy to follow that up. But it's not being closed because of a ventilation deficiency. It's being closed to do a terminal deep clean. That's a really important point. I can't give you a date, but as soon as well, there's no lasting plan to keep it shut, but I can't tell you when it will reopen. That'll be that'll be a matter for how long that clean takes, and as soon as I've got anything to update, I will.
When you say that there's no problem with the ventilation, is that because of the review that's ongoing, or how can you say that?
Well, no. What I'm saying to you is what I said. It's not being closed because we are aware of a ventilation issue, right? So that we may become aware of one, or we may not. But the note to suggest that there is a proven, established deficiency in the ventilation there or anywhere else is not necessarily accurate. That's the point I'm making. It's closed to do that absolute industrial grade clean, which you just can't do if the place is full of people, whether they've got it or not. It's just a practical thing. We can't deep clean the room, each room, if there are people in them. Then we'll go to Rich and then Samaya.
Talk about change. It's time to change the model and take hotel quarantine out of cities, move to country, move to mining towns, etc.
I'm not opposed to that. I've been asked this question a few times, and what I've tried to be is as honest as I can be. I think we need to be careful not to assume that would therefore be zero risk. You're still going to have a workforce, and the workforce will have families, and the workforce will travel to and from, unless you did kind of remote or ultra secure. I saw Avalon mentioned yesterday. So, well, there's many different facilities. People have talked about mining camps. Army barracks could maybe do the same thing, where you were away and you had a perimeter that was absolutely secure. You could go to this kind of fly-in, fly-out workforce where they lived on site, well away from the guests, but they lived on site. I think the notion of a state government doing that on our own would be pretty challenging. We'd need a partnership to do that. And well, Howard Springs has certainly been talked about. I think there's some ongoing discussions between the federal government and the Queensland government about a facility, and I'm not certain if the Prime Minister would welcome that discussion, but that may be something that we have to do. Again, back to this central point, it's not the virus we were fighting a month ago, it's something different, and therefore we have to every day look for ways in which we can make it safer. Never zero risk, that's just not possible, but we've always got to be doing everything we can to reduce that risk and to stay either right on the heels of this virus or indeed in front of it. That's what the testing's all about, for instance.
What is the ventilation order and engineering report say about the Holiday Inn?
I don't have those in front of me, but I'm more than happy to come back to you on that issue.
How thorough was it?
Well, all of our audits are thorough. All of our audits are thorough, and I again just make the point, there's no suggestion at this stage that we're talking about a ventilation issue. There are many other ways to explain, and the evolving but active theory that Brett's just taken you through does not speak to the notion of air conditioning having caused this. The fact that the rooms are opposite each other, the fact that there is this fine aerosolized particles because of the use of this medical device, that's the space we're in. But on the specifics, if there's more I can add, if we can get you some stuff offline, we will.
Just a park height question, I'm not sure it's Emma Cash or Brett's up, but I mentioned before that maybe the virus is present 3 or 4 doors down. Can either of you answer if that's the case? That's the park height question. Or I don't know.
Well, I can tell you that there is some environmental samples, what's called environmental samples, where we look at physical spaces, and there were some traces of the virus not just outside the door, but some distance away, and we've put an appropriate public health response around that.
Just interested, how far is that? Is that 10 metres, 30 metres? Do you know?
I'm not sure. I'm not sure that we're able to say, but it's if we can come back to you with a exact metre, then we will.
That's like a nebuliser. That's like
No, exactly.
Family,
That's
and it's
exactly.
down the corridor
Yes.
a number of doors.
Yes.
To clarify,
And again, but not to be
Oh, sorry. Thank you.
royal, not to be, not to necessarily speak to that example, but the other one that we've had thrown into the mix is family. They're in a room, they've got high viral load, their aggregation makes it even higher, and doors open, all of those things. So again, these are just a series of very detailed real life examples where this virus is different, and therefore our challenge is different, and we need to step up to that, and that's what we're doing. And I can't rule out that there won't be further changes next week. I don't quite know what they would be, because we really are, this is very thorough, and there is an enormous amount of resources and energy and a very low, if any, tolerance for risk. But we all have to accept that if you run a program like this, no matter how high the standards are, the AMA and WA have said all sorts of things about our system, that it's very, very high standard. But it's not about if, it's when one of these cases will get out, because it's so infectious.
Do you have any update on how many workers have been tested on their days off so far?
No, but if I can get you one, I will.
The Holiday Inn guests being transferred, grouped together in buses. Is there a particular reason for that? And is there any reason why we haven't opted to transfer them ambulances?
The mode of transport will be based on advice and any clinical need or any infection control risk. So no matter how they get where they are going, that'll be done safely.
But just given the level of transmission that there has been at the Holiday Inn hotel, wouldn't it have been safer to use ambulances?
No, because what I'm saying to you is that the safest method will have been used. They will have done a full rating of what risk those people posed based on their individual circumstances and their shared circumstances. I'm happy to ask the question for you, but I can confirm for you that in all these decisions, safety, not just for hotel guests, but safety for staff, is absolutely paramount.
And how many guests are being moved out of the Holiday Inn?
Emma may have that number.
48.
48, I'm told. 48.
Should Crown Melbourne keep its gaming licence?
Sorry, what was that?
Should Crown Melbourne keep its gaming licence?
Well, it's a bit early for us to answer that question. What we are going to do is we've already begun the process of thoroughly reviewing the findings of the inquiry in New South Wales. We've already made some announcements about the bring forward of the 5-year review, and we'll have more to say about that matter soon. These are very serious issues, and we take them very seriously. But I don't think it's unreasonable for us to, just as I think the New South Wales government are doing, we'll look at those findings. They were only handed down yesterday, and we will have more to say soon.
Why not take a New South Wales inquiry to find these goings on in Melbourne Victorian regulated? Is that regulated people?
I wouldn't say that. I wouldn't say that at all. However, whether it be by investigation or quite shamefully by admission, there's a need for us to have a look at all these issues by admissions made by very senior people at Crown. So we will review, and we won't waste any time doing it. We're looking very carefully at all the different findings that have been made, and we'll have more to say quite soon.
That doesn't really answer the question about the failure of the Victorian regulator to do its job.
But you didn't put a question to me, Rich. You made a statement, and I said that I didn't agree with that.
Okay, I'll put the question. Has the Victorian regulator failed?
Sorry, is it statement? Okay, maybe that is a question. I don't accept the question or proposition that you're putting forward. However, I would say to you that, we're not stubborn about this. If there's need for improvement anywhere in government, then we stand ready to do that. But again, all I'm saying to you is there'll be a day to have a very long discussion about all these issues. I don't think it's with the greatest respect. I know why you asked the question, that's fine. But we do have to just take the time to read the thing, go through it, understand it, maybe speak to New South Wales. I'm not sure how that will work, but very soon, once we've considered what was handed down just yesterday, we'll have announcements to make.
But you're taking
Isn't
time,
the key
you're
point though, if New South Wales found is not suitable to hold a casino licence, doesn't that ring alarm bells to you? About what
And that's why we've...
based on what
Yeah, sure. No. Well, we didn't... Again, I don't think we're that far apart, Rich. We announced some time ago, before Christmas, that we were bringing forward the 5-year review, not for fun, but because we have significant concerns. We're reviewing the findings, again, not as a pro forma exercise, but because we have significant concerns. Once we've done that, and it won't be months, we'll do it quickly, and we'll have more to say about it then.
Speaking of
This is when
balance,
you
on
haven't
the
even
7th
announced who the
of
commissioner was going to be, and it's been...
Sorry?
The announcement of the special commissioner for the review
Yep.
of the ground hasn't been announced yet.
It hasn't been announced because you've got to be meticulous in having exactly the right person to do that work, and we'll have announcements to make about that soon. Well, there are a number of people that we've been speaking with, and some people are available. They're busy people doing other work, some people aren't, and you've got to have somebody who is absolutely impeccable when it comes to not just who they are, but the way they're viewed. So it's a very important choice.
Is that why it's taken almost 2 months to appoint that person, to announce that you were setting up a special?
No, I wouldn't put it in those terms. I'd simply say it'll take as long as it needs to take to find the right person to do that important work. And when we're ready to make that announcement, we will.
You've been answering these questions for more than 2 years now. Is there going to be any kind of expediency to these kind of proceedings, or are we just going to flop around for 2 or 3 years?
Well, again, you're kind of inviting me to accept the conclusion that you've drawn. I wouldn't necessarily accept that as the
What, that Rich hasn't been
style.
background to...
No, I think there was another reference. Well, again, if I was to rate questions based on how often they're asked, that could take us in many different places, I would have thought. I don't want to make light of this. It's a significant issue.
But it's
And we will...
significant,
Yeah, and...
Look, he's raising money laundering claims 4 years ago, and the age is raising them a year ago. He still hasn't named anyone. That is the definition of being toothless.
No, it is not. Getting the right person is important. And when I have announcements to make, I'll make them. And you can then reflect on the person I announce and the time it took to get it done and all of that. That's part of your job. This is a serious matter. We take it seriously, and we'll have an update soon.
New South Wales announced an inquiry after the age in 60 Minutes report because they were concerned about what they heard. Did the VCGLR actually look at Crown after those video recording and the allegations?
You'd have to speak to the VCGLR about that.
Was there any concerns
Do you know
about...
if they did look into
As I said, you'd have to speak to them about that.
Was there any concerns...
Did the gaming minister at the time speak to you about the allegations that were raised in the media reports?
I would need to check my records about that, but probity and the highest of standards in all of right across this industry is something that's a daily. It's the work of regulators and ministers and the government every single day.
Then has it failed, given that the probity has led to the...
No, I think let's work out what's happened first before we make those judgments. These are serious matters. They're taken seriously, and I will have more to say soon. And you can reflect on that if you choose to. What I'm focused on is taking it seriously, getting the job done. I don't think it's unreasonable for us to read a report, understand it, that was only released yesterday, and then make some decisions. I don't know that you could necessarily have acted on findings that had not been handed down. What we did act on, and this is the key point, admissions were made. That was, we didn't have to wait for the report. Those admissions were made. And on that basis, we announced that we would bring forward the review, and work to deliver on that commitment has already started, and I will soon be able to indicate to you the personnel and the process and hopefully some timelines.
Did the minister at the time or anyone that was overseeing that review raise concerns with the head of the VCGLR and the fact that they were unable to find out
Sure.
enough information?
I'm not certain about that. I would need to check that.
Those admissions were made because New South Wales was able to put together a review and complete it at
Yes.
the time that Victoria has been talking about it. It's had immediate consequences. Already this morning, 12 packers men on board have stepped down, and the regulator in New South Wales said it shows people listening to them. Why
Yes.
is it that Victoria was waiting for admissions to be made in New South Wales before even speaking?
No. Let's go back to the beginning of your question, where you've indicated that New South Wales were doing something while we were talking about it. That is not accurate. If there's a process in New South Wales, then it's appropriate to wait till that process is concluded. However, if in the running of that process admissions are made, so you don't have to wait for findings, people have in their own testimony admitted to have done or been involved in certain things, then you can act, and we did. And I think you'll find that admissions were made and action was taken in good time, just as our review of the findings will be made in good time, and we will have further announcements to make about this soon. And I wouldn't want anyone to underestimate how seriously we take these issues.
Victorian president also broke that, gambling regulator, that we had to hear admissions in the New South Wales inquiry for us to actually even, bring forward the speed of the review.
No, I wouldn't accept that. But what I will accept is.
Would anything have happened if New South Wales hadn't conducted the inquiry?
Well, that's a definition of a hypothetical, I suppose, isn't it? What I do accept, Samaya, is that it is our responsibility to make sure that the only people who hold a casino licence in Victoria are people of the highest quality and calibre, probity, and are accountable for all of their actions. And that's exactly what I intend to do, regardless of who those people are.
Have you spoken to James Packer or anyone from Crown Holdings over the past couple of years?
Last couple of years?
Last 2 years?
Not. I think I've had one conversation with Mr. Packer about totally unrelated matters.
What was that about?
Well, I think that related to employment, and some changes they were making on the board. Simply, he was advising me of changes that were made. I'm not exactly sure when that was, but these matters were in no way canvassed, nor would they be.
Given the Special Commissioner is working still under the VCGLR banner, is it time
Yes.
to make that an independent process outside of the VCGLR because they could be part of the problem?
Well, casino regulation may need its own bespoke authority. And I think that's something that the report yesterday went to. It's something that we've been giving some thought to for a while now. And I'm not making that announcement, Rich, but in trying to answer your question, that may be something that we need to do. Because obviously, the issues at a big, unique, single-site venue might be, in fact, are very different to a liquor licence in the suburbs, or a liquor licence or a gaming licence at a pokies venue in regional Victoria.
Has Eddie Maguire done the right thing?
Oh, look, if you look at the statement he made yesterday, I think he's made a decision that he's explained why he's done that. I wish him well, and I think his statement speaks for itself. I'm not going to interpret that.
How do you respond to the charge? How do you respond to the charge that among Melbourne's ruling class, principle goes by the wayside when a mate needs a shot out, and you're one of the worst offenders on that score?
Who might be suggesting that, James?
Aurelia Lumumba?
Anyone else might be suggesting that?
Isn't that enough? He's the one who's raised
Well,
the allegations that's led to Eddie resigning.
people are free to have.
Your comments yesterday, you're more interested in looking after white mates.
Well, I wouldn't accept that, and with the greatest of respect, people are entitled to their views. That
you
is
have pointed
that
out-
I don't think that is something that I really need to get into. I would not accept that.
You were pretty willing to come out and condemn Margaret Court for things that you didn't think were ethically correct, but you were a little bit, you haven't condemned Eddie for his comments. People are comparing those two. What do you say?
Well, people are free to have views. That's fine. That's part of our democratic system, and I freely acknowledge that not everybody will share my views on every single matter. But I was asked a series of questions and I answered them.
If you had your time over yesterday, would you have been as supportive of Eddie Maguire?
Absolutely, I would have been. Because the thing, Rachel, I was asked a question and I answered it. And if you'd asked me the same question, today or in different circumstances, my answer would not have changed.
Has the government had any discussions with Global about closing?
Yeah, there's ongoing discussions with them. We wish those workers well. This is very challenging for them. Obviously, we'll support them in any way that we can. I can confirm that we've been in discussions with the company. The federal government have been in discussions with the company. Every effort was made to try and get a different outcome, but they've made a decision, and now it'll be really important that we support those workers, and we will.
It's come at a time when we're obviously...
Well, I think we've done our very best. Offers have been made, we've had talks, we've been as constructive and as engaged as we can be, not just in the last few days, but for a lengthy period of time. And I don't think we can change their mind on that. And again, we're not pleased about that, but that's the nature of private companies can make these sorts of decisions. We will now be very much focused on supporting those workers, and if there's any support they need, retraining, skills, other job opportunities, will be there for each of those workers and their families. It shouldn't do, but the supply chain impacts, particularly for byproducts and things, for other manufacturing for instance, all of that is something that we're working through very closely. Senior ministers had a discussion about this yesterday, so we'll continue to be briefed on that, and if there's anything we can do to bring greater certainty to that industry in light of this private company's decision, then of course we will.
The closure of the refinery was obviously from the time when there's still, there's still unemployment because of the COVID-induced recession.
Yes.
Any comments to make around that and about what kind of impact this might have on just Victorian?
No, I'd simply say that we are, in a very significant fight against the damage that this virus has done to us, and we've got to work hard, all of us, to implement the decisions we made in the budget to continue that important economic recovery, to heal those wounds, to repair that damage, and that's a 24/7 task, and it won't be over soon. It'll take some time, but the early signs, notwithstanding this particular decision, and in no way glossing over it and the impact it'll have for those couple of hundred workers and their families, the data in recent times has been very positive, and the briefing on Friday from Stephen Kennedy was equally positive. But we've got a long way to go, and we're determined to do it.